But we start this hour with this story. Denosa in Kwazulu-Natal is urging the health department to ensure that all healthcare workers get the jab first. It wants the Sisonke vaccine trial to be extended and phase 2 of the vaccination rollout to be pushed back. There are long queues at St. Augustine Hospital in Durban as health workers wait their turn. eNCA's Dasan Tathia is there and joins me now for an update. And Dasan, so it seems, Dasan, that the message is clear from Denosa. No start to the general public, general population, senior citizens vaccination until all healthcare workers are vaccinated first.
Well, that's what they want, and I can understand why Denosa is saying that. I mean, if you just look around me and you look at these lines, and this is now a day before this is meant to be, before this week ends rather. This is the scramble now for these healthcare workers to get their vaccinations. Some of them returning here to us because they had come through on Tuesday, but they say that they were told that there were not enough doses for them by about 2 p.m. on that day. So some of those have also joined in the queue. But you can just walk with me, Tulas, as we try to figure this out. And I'll tell you why I'm saying that. You see, there are two lines here. One is to the left of me and the other is to the right. And me, like many others that are in this line, are also trying to understand what's going on. I've spoken to some of them off camera. Many are camera shy, so they didn't want to do interviews during this live crossing. But what they're saying is that they have been moved from line to line. Some of them have vouchers, which are supposed to be getting them in here to get their vaccine. Others don't. And the fear now is that those that don't have voucher numbers will not actually be getting vaccinated. This was meant to be by booking and by appointment today, especially after the chaos that unfolded here on Tuesday. But there's a lot of unhappiness here. Many are questioning how this process is being handled. You'll see that police have also come in here to kind of manage the process and make sure that there's not too much obstruction. But one of the bigger concerns is whether this process will actually be completed and all of these healthcare workers will in fact be vaccinated. So let's listen into some of that interview that I did with Mantla Shabangu from Denosa about extending the study.
There's a group of healthcare workers from the Department of Health and there's a group of private sector, meaning private, those are GP, whoever who's private. Now, I'm told that there were messages that were sent from national to people where they registered, Sisonke, to say even if you don't have appointment or voucher, just come in. Now, that is why you are finding now a group of people all converging in one, because as from 2 weeks back, the process has been smooth here in the site because people who are coming are those with appointment and vouchers. But this message that came from Sisonke has caused the whole instability inside because now you find two groups of people here, but the understanding is that people who must be here are people with SMSs and appointments. So we've spoken to management to say how to then navigate that part, because we expect that every healthcare worker who's here must be vaccinated no matter what. Yes, tomorrow is a deadline for this vaccination program, but we are saying they should move it until sometime next week so that all workers are vaccinated, because we don't want a situation where we're expected to go and vaccinate the over 60 that have started being registered without all healthcare workers all being vaccinated.
So, Dasan, those queues that we are seeing there, those snaking queues are concerning, right? Especially with issues of social distancing that we've come to know about, I mean, over a period of more than a year now. If someone was to come there and say, what is the problem? Does anyone know why people are queuing?
That's just it. It doesn't seem to be the case. And while I'm saying this to you, Tulas, let me give you a broader view of what's happening at the gate. This is the point at which they are converging. You'll see that there's absolutely zero social distancing here. As I mentioned earlier, traffic can barely even get through this road. This was also one of the concerns that Denosa had raised as well. Mandla Shabangu, who had actually met with the management here earlier today to put forward some of those concerns. But at this point, all it does seem, Chulas, if I could give you an answer while I wait for an official response from Netcare, that it seems that these two sets of messages seems to have confused some. Some people, as I said, were issued with vouchers. Others had just received a message that was saying that they were now enrolled to get the vaccine. But interestingly, the few that I did see with vouchers had all specified that they should be here at 8 o'clock. But that's by no means a scientific answer. It's just the few people that I did speak to all showed me their vouchers showing that they had to be at 8 o'clock. Now, if I had to speak frankly to you, Tudos, I'd say that that seems irresponsible, because surely this should have been staggered to prevent what we are seeing here right now.
I mean, if you're saying everyone must show up at 8 o'clock, they will. And this is the result that you end up with. eNCA's Desan Tathia out in Durban monitoring that vaccination process at St. Augustine's Hospital there, and also seeking answers as to why it is that at the point at which there are warnings from officials about the real potential of the country going into a third wave of infections, you are having those healthcare workers being made to queue in that fashion, in that manner, outside there for a vaccination. So hopefully we'll get some clarity there, and those queues will hopefully start moving. Let's stick